Our final speaker this evening is Lizzette Yearwood. She's the Chief Executive Officer of the Cayman Islands Health Services Authority. Ms. Yearwood is also a registered nurse and as CEO has overall responsibility for the day-to-day operations of the Cayman Islands Hospital on Grand Cayman, Faith Hospital in Cayman Brac, as well as district health centers and clinics on all 3 islands. She has over 30 years of progressive experience in local and international healthcare. She has used that experience to contribute to the growth and success of the HSA. She's a tireless warrior within the local healthcare ecosystem. Lizzette, I hand over to you now for your remarks.
Thank you, Ben. Good evening, everyone. It's really a pleasure to have you all here at our 15th National Healthcare Conference. And I've had the privilege to be the chair of the planning committee from its inception. And each year, we manage to get even more dynamic speakers and attentive audiences. So thank you all for your support. Thank you all for your attention. Now, I know that I'm standing between you and the cocktail hour. But I have something important to share with you. You're not going to get that cocktail unless you stay till the end of my remarks. So I'm going to make it quick. Okay, here we go. So I'm sure you will agree that healthcare is vibrant. It cuts across all borders and requires a collaborative approach with the patient at the center of every decision. Yes, Shamari, we do agree on that. That's why this year's conference theme is very fitting as it reflects the reality of healthcare in the 21st century. Indeed, healthcare has its own ecosystem, an ecosystem that is impacted by the environment, the economy, education, living conditions, as well as social and lifestyle factors. As you just heard from Mr. Shamari Scott, our healthcare landscape here in Cayman is changing very rapidly. Advancements in medical technology, facility expansions, and a focus on patient-centered care are ensuring that the Cayman Islands remain at the forefront of global healthcare trends. As we navigate these changes, one constant remains: the importance of our national healthcare system that provides accessible, affordable, quality healthcare for everyone. At the HSA, we have advanced from a modest 4-bed hospital in 1937 to where we are today as a cornerstone of healthcare in the Cayman Islands, serving residents across 9 locations on all 3 islands. HSA is honored to be your trusted provider, not just for the care we deliver, but for the critical role we play in the broader health system. While our history grounds us, we are focused firmly on the future. We are working collaboratively with our care providers in the private sector to build a stronger, more resilient healthcare system that benefits the people of the Cayman Islands. Minister, I am truly inspired by your efforts, as well as the HSA Board of Directors, who have shown foresight and are making strategic investments to modernize and expand our national healthcare system. And this will ensure that our services and facilities are sustainable for years to come. As our population in the districts grow, so does the need for additional services. This year, we placed a new EMS station in the Bodden Town district, and we will soon be opening a new dialysis unit in West Bay. This further demonstrates our commitment to providing timely, life-saving care closer to home for the community members of these and neighboring districts. A new emergency room and imaging center in Cayman Brac, along with a new Bodden Town Health Center and an expansion of the West Bay Health Center, are just a few more exciting projects that we will be delivering in the not-too-distant future. While it is always exciting and gratifying to provide new modern facilities, we realize that expansion is more than just physical infrastructure. It is really about the incredibly skilled team of professionals who work daily to deliver passionate and outstanding care. This year, we added our first neonatologist consultant. This will allow us to provide advanced care in the NICU for some of the most vulnerable patients right here at home. Equally important is our commitment to mental health. Unfortunately, we are seeing an alarming increase in the number of mental health patients across all age groups, but especially amongst our youth. In just the first 9 months of this year, we have seen they double the number of adolescent patients that have been admitted for self-harm. Mirroring this increase is the number of outpatient visits to Alex's Place. Alex's Place is our emergency mental health hub for adolescents aged 10 to 20. In 2023, there were 1,043 adolescent outpatient visits to Alex's Place, compared to 1,941 visits already in the first 9 months of this year. We are committed to continue to prioritize the expansion of our mental health services across our islands, especially the acute inpatient services. And for the first time, we've hired a new full-time psychologist at the Faith Hospital in Cayman. Our healthcare system must not only serve today's needs, but we have to anticipate and adapt to tomorrow's challenges. This includes addressing the rise in chronic conditions like diabetes and hypertension through early intervention and personalized care, ensuring a healthier future for our growing and aging population. And you heard earlier about the STEP survey and the results that has provided us to move forward with. However, beyond our role in healthcare, the HSA is also a significant economic engine driving our nation's prosperity. As one of the largest employers in the country with over 1,200 staff, we provide stable employment to over 700 Caymanians and permanent residents. We also invest significantly in training programs such as our EMT course, our Transition to Practice nursing program, training for phlebotomists and operating room aides, just to name a few. Initiatives like these are helping to develop local talent, reducing the need to increase our labor import while fostering a robust, self-reliant workforce. Some 37 Caymanians have already been promoted this year at the HSA, and through our succession planning program, we will ensure that Caymanians continue to gain the experience and mentorship needed to transition into key roles. As an accredited teaching hospital, we also are proud to have assisted 7 Caymanians to successfully complete the Doctor of Medicine in Family Medicine, while training 38 medical interns at HSA over the last 11 years, of which 20 are Caymanians and the other 18 are from countries within the region. Of that 38, 30 have gone on to become specialists. So what does that mean to our patients? It means that we have a dedicated team to provide comprehensive, compassionate care for everyone in our community, whether through improved accessibility, physical expansion, or partnerships with our local and international healthcare providers. We are dedicated to ensuring that every resident can access the care they need when they need it. It also means that we are listening to our patient feedback. This is demonstrated by the opening of a new patient call center and a significant expansion of our patient experience team who assist patients navigate throughout their healthcare journey. What I've shared with you this evening is just a highlight of how your national healthcare provider is investing in your community. Over the next 2 days, you will have more informative presentations, panel discussions, and breakout sessions exploring the challenges and opportunities that lie ahead for healthcare here in the Cayman Islands. Let us continue to strive, innovate, and collaborate to build a stronger and more resilient healthcare ecosystem. Together, we will ensure a healthier, more sustainable future for our islands. Thank you very much. And in 2 minutes, you can get your cocktail.